We decided to go with Healthy Blue Living because after a couple of years of watching it from the outside, we decided it was a good fit, and we saw some of the companies that were on board that had very matching cultures. So we decided that it was a good plan for us. We hit all the key points, and it's basically like a good partnership. It keeps us on track. We already had the intention that we want to make sure that we get checked every year, and that we keep on the all the different key points that we need to cover. So I guess it just reinforces what we're already doing, and of course I love saving money, so that's always a good thing. Actually, we have used a few of the resources that are at Healthy Blue Living. We've had 2 different guest speakers come in and talk, one about nutrition, one about just general fitness and overall good health. So, and we did have like a mini screening session, and they brought some great material, etc. with them and answered any questions that we had, so that was great.
Healthy Blue Living is a great program for budgeted families, I would say. Mostly the reason that I chose it was for the cost savings. I do like that it's a kind of a forced overview once a year to go to the doctor and get your blood work, and, which especially was good for my husband, who really dislikes going into the office and doing all of that.
From a personal standpoint for me, what's really interesting about Healthy Blue Living is how impactful it was to me. I didn't realize it until I participated in, specifically I'm talking about the once a year proactive health visit you must make to your physician. I'm surprised that I actually look forward to that annual visit now, because I know I'm going to check my weight and cholesterol and the kinds of things that really will lead to long-term health for me, and that's really important. So that was a pleasant surprise, being part of the Healthy Blue Living. Another area that I think is interesting is my son has asthma, and I get targeted mailings about that particular condition, and so it gave me a sense that even though it's a big company, they were maybe dialed in on something that was very personal to me, which is the health of my family.